And now we turn to the H1N1 virus. This week, Nigeria announced its first case of the swine flu virus, which can be deadly. It is just the latest country on the continent battling the pandemic. Health officials say the virus could ebb and flow for up to 3 years, with more than 30% of the world's population affected. Voice of America's Laura Bowman reports.
From Europe to Asia to the Middle East, the 2009 H1N1 virus is spreading. The World Health Organization reports the virus has killed close to 6,000 people worldwide.
I come home from the street, take the mask off, wash and iron it, and make my children do so too.
Hundreds of thousands of doses of Tamiflu, a treatment for H1N1, have arrived in the Ukraine, which has reported a sudden outbreak, killing at least 22. Ukrainian Prime Minister Yulia Tymoshenko met the plane on the tarmac.
A large number of the most needed medicines to treat those people who have caught flu have been delivered today. It's called Tamiflu. I have it in my hands.
The government has closed schools, limited public gatherings, and imposed travel restrictions with enforcement at the borders. Health experts in Germany are also reporting an alarming rise in H1N1 cases. Most troubling, many aren't travel-related, but are developing inside the country. German health officials are worried.
If you want, you can say the wave has begun.
Health experts say that here in the U.S., an estimated 1,000 people have died of the 2009 H1N1 virus, with roughly 1 million infected. Most of those cases have been tracked since September, the onset of the flu season here. In China, because of slow global distribution of the vaccine, the Chinese have produced their own. The government has launched a massive vaccination campaign. So have 16 other countries, including Japan and Israel. In Afghanistan, many residents blame foreigners traveling to their country for at least 2 confirmed H1N1 deaths. Health officials have declared a state of emergency for 3 weeks.
Whoever comes from abroad should be checked before entry. If they are well, they should be able to enter. If not, they should be deported.
Deporting sick travelers might not do the trick, says microbiologist Dr. Andrew Pecos, since people can carry and pass H1N1 for up to a day before developing symptoms. His advice to those with access to the vaccine: get it now.
The vaccine is safe when administered to a number of different populations, and it also induces a very good immune response, which should protect you from infection if you get vaccinated.
He repeats the best protection against catching and spreading H1N1 is good hygiene. Use a tissue or cover your mouth. Health officials say to date more than 440,000 people around the world have been infected with H1N1. They say before the pandemic ends, 30% of the world's population may have been infected. Laurel Bowman, VOA News, Washington.
And that's your health news for today.
Thank you so much, Lenore.
Sure.
I really hope that vaccine turns out to be viable and strong.
Absolutely, we do
We'll wait
hope
and
so.
see, and I know you'll tell us all about it.